Hello, I'm Simon Matthews, a director of the Global Positive Health Institute, and welcome to this episode of High Five, our science podcast for just 5 minutes, touching on an area of positive psychology and a bit of the research behind it as well. In today's episode, how much social connection do we really need to stay healthy and happy? Well, to answer that, let me ask you this. When was the last time that you had a meaningful connection with someone? Not just a quick text or a thumbs up on social media, but an actual moment where you felt seen and understood and supported by that person. It's likely that we all know that science tells us that social connection isn't just something that makes life pleasant. It's actually a core human need. It's as essential to our health as food and sleep and exercise. So today we'll touch on why it's so powerful, what it does to our body, but also how much of it do we really need to stay well. And to do that, we're going to draw on two landmark studies that really did reshape how we understand human health. Let's start with what's happening inside of us when we actually make a connection with someone. When we spend time with people that we know, people we trust, people we like, our brain releases oxytocin, the so-called cuddle hormone. Oxytocin tends to lower cortisol levels in our bodies. Cortisol is the stress hormone. It tends to reduce blood pressure, and it even has anti-inflammatory effects. It's part of why a hug can feel so calming when we experience it. At the same time, our vagus nerve, a nerve that is part of our parasympathetic nervous system and runs quite a way through our bodies, helps to regulate our heart rate and calm us down. When we're in the midst of safe, warm interactions with others, this whole system kicks in and it slows our heart, relaxes our body, gives us that deep sense of safety. In short, we're wired for connection, and when we do make those connections, our brains reward us for them. One of the most eye-opening studies in this area comes from Julianne Holt-Lunstad and her team, all the way back in 2010. They analysed data from 148 studies covering about 300,000 people worldwide to examine how social relationships affect mortality risk. What they found was that people with strong social ties, supportive family, supportive friends, or even community, had a 50% greater likelihood of survival over time compared with those with weak or limited social ties. To put that in perspective, that health benefit, the 50% greater survival over time, is equivalent to quitting about a 15 cigarette a day smoking habit. And it's even stronger than the benefits of regular exercise or maintaining a healthy weight. So social connection isn't just good for mood. It's literally life-saving. It impacts immune function, it impacts cardiovascular health, recovery from illness, and even resistance to stress. In other words, friendship and love are not just nice extras to have in our lives, they're actually critical health factors. The Harvard study of adult development, directed currently by Robert Waldinger, is one of the longest running studies on human happiness. You've probably heard of it. It's tracked over 700 people since the 1930s, including famously the former US President JFK. They've been following participants across 8 decades of the study, collecting data on their physical health, mental health, social relationships, work, and life satisfaction. And what the researchers learned was that the clearest predictor of who would stay happy and healthy into old age wasn't wealth, it wasn't fame, wasn't career success, it was the quality of those close relationships. And those who felt most securely connected to their partners, friends, and family were physically healthier, had sharper minds, and they lived longer. Even more fascinating, once participants reached the age of 50 years old, the quality of their relationships predicted their health at age 80 better than their cholesterol levels did at that age. So these two studies together show that it's not about having lots of friends or lots of social activity. It's about having a few trusted, close relationships where you feel safe, supported, and known by someone. So How much do we need at the end of all of that? Well, here's the encouraging news. We don't need to be surrounded by people all the time or have massive, massive social circles. What we do need is at least a couple or a few close, supportive relationships. People we can rely on, people we can confide in, people we can share our lives with. And even small daily interactions can help as well. Chatting with a neighbour, laughing with a colleague, calling a friend, all of those things can help boost mood and reduce stress. So the key at the end of the day is not quantity, but quality and consistency. A few meaningful connections nurtured regularly can meet most people's social needs. Good relationships protect our bodies and minds. They lower stress, strengthen immunity, safeguard the heart, and they help us live long and happy lives. So reach out, connect, and invest in the people who nourish you. Because at the end of the day, connection doesn't just feel good, it keeps us alive.